deadline and things like that, I think, as they got off work at 11:30 or something. So this is an informal, we're among friends here, and the idea is to get you information. There are some very significant healthcare legislation bills going through right now. Most of them have gone through one chamber and in the other one, and we're not seeing a lot about them, frankly. And so we felt that we needed to provide a little more information, provide a little bit more visibility on some of these. Some of them address directly the federal healthcare legislation, some of them designed to address that, and some of these bills are completely independent of the federal healthcare legislation, are just designed to do the things that we all, I think, agree need to be done with healthcare. We need to increase access to quality care and decrease costs. And a lot of the stuff we're seeing doesn't do that. So again, these gentlemen are trying to address that to some degree in Montana. So they're each going to get 10 minutes at the most. We're going to hold them to that because they're the ones that are driving the schedule. And then hopefully at the end we'll have a few minutes for Q&A, but probably not a lot. And what I want you to do is come out of here either with some good information that you can use moving forward with the legislature, or some good questions. And then after they're done, Rob Nadelson is going to get up and talk about some of the constitutional aspects of this. He and I, and I'm sure there are other people in this room who know more than we do, will probably be able to address any questions that come up as well. And we're going to stop at 1 officially, but we'll stick around as long as anybody wants to stick around. Is pretty much what it comes down to. I'd like to thank Mary and the ladies out at the registration table. I don't know where Mary went. Mary Beveridge and the ladies with the Big Sky Tea Party for helping us. They're rapidly becoming our Helena events coordinators, whether they know it or not. They've done a very nice job with this. And the Red Lion, as always, does a very nice job setting these things up. If you look at the middle of the table, you see those fancy centerpieces. Those are empty bags, and the idea is that we don't want them to be empty. You'll see two things around them. One, of course, is I would lose my nonprofit president secret decoder ring if I didn't say there's a contribution envelope. Obviously, at 10 or 15 bucks a piece, we're not making any money on this. If you want to see more of these types of things, we need help financially to put these things on. If this is worthwhile, feel free to drop something in an envelope and drop it in the bag, and we'll be happy to collect it. The other thing is a card, just a regular little business card thing that if you're not on our mailing list, or if we have the wrong email for you or something like that, please fill that out and throw it in the bag, and we'll update our database and make sure you hear about all these things in the future too. And finally, each of you got a registration packet. Look inside your packet, and if you have a little orange dot, you get a free book, The Battle by Arthur Brooks. This is a great book that talks about the moral arguments for free enterprise as opposed to just the economic arguments for free enterprise. So bring your little orange dot up to me or Mike around here someplace, and we'll get you your book. If you're interested in this book, we can make sure you get one of those as well. We have a table over here with pretty much everything we put out. Some of it has to do with climate change, RPS, healthcare, budget issues, things like that. Feel free to peruse. Make sure you have as many pork reports as you need for you and your friends. There's a flyer over here for the Bozeman Tea Party event that's coming up in April. Sheriff Mack and some other things going on there. I've encouraged you to take a look at that. And with that, I think we'll get this thing going. And Jason is looking at his email. But okay, so here's the deal, gentlemen. Hi, Champ. Thanks for coming. Again, thank you for these guys too, because they're going to probably leave in onesies and twosies, so let's thank them right now for spending their time here. Each of them is going to spend 10 minutes, and Jane is going to be the enforcer on that, talking about what they're trying to do. Again, let's hold our questions to the end so that we can get through everybody, and then with what time we have left, we'll address any questions we have. But I want to give everybody a fair opportunity to talk about their legislation so you can learn as much about it as possible. So, Senator Priest, you're up.
Thank you very much, Carl. My name is Jason Priest. I represent Senate District 30, which is Carbon and Stillwater County. Thanks for having me. Carl asked if I would talk a little bit about Senate Bill 106, but I'm going to, if I can, just set the agenda a little bit for your perspective. There is no such thing as made in Montana Obamacare. The bill is very prescriptive and limited as to what we can do as a state. We're given the option to make the bill more onerous for taxpayers, and small businesses that provide health care for their employees because of the new taxes and the new regulations and the new funding of the state, but we're really not given any flexibility to opt out of the program. It is truly a federal program that is shaped by the feds, and whenever there's an opportunity to quote-unquote shape it in Montana, they always decide if we did our homework properly. So the number of us have been talking about this for a while, and we came here specifically this session with a two-part agenda. And I think you're going to hear about both parts. One is we're going to resist Obamacare every chance we get. We're going to do it sometimes through things that are symbolic, but we're also going to do it every chance we get to stop the appropriation process. We're going to do it when we're faced with an implementation choice. We're just simply not going to implement the bill. And I feel confident, if the first half of the session that we're executing on that part. The second thing we're going to do is we have our own reform agenda, and we think it's a better agenda, and you're going to hear about it today. And I'll tell you about one of the ones that I have. I'll also just quickly dispatch with there's been a lot of flap on this discussion about Obamacare versus the Patient Protection Affordable Care Act. So I looked it up. If you look up Obamacare on Google, there are 3.1 million links. If you look up Patient Protection Affordable Care Act, there are 321,000. So it's a roughly 10 to 1 if you want anybody to know what you're talking about. And if, this is their signature achievement. This is the completion of the progressive dream. They own it. They're proud of it. And I think it's, we owe it to the public, so the public knows what we're talking about. And the public knows this bill is Obamacare. And there's no disrespect meant to the president. If he's proud of his achievement, then he can accept responsibility for it. Senate Bill 106 is a very simple bill. It's part of the repeal, our repeal agenda. Senate Bill 106 makes joining the Florida lawsuit the law of the land in Montana. Senator Shockley, who's with us today, said it very well. Montana needs a lawyer, and Attorney General Bullock is our lawyer. And so we are, through Senate Bill 106, joining the federal lawsuit the law of the land, and he's our attorney, and as such we expect him to represent us in that lawsuit. Now, we thought about finding other attorneys. We considered that option, and Senator Whittick has experience with that, and if he has time he may tell you, we simply have tried it in the past, and it hasn't been effective, nor do we think it's even possible under the Constitution. What is possible is for the legislature to define, as in 215-501, other duties as required by law for the Attorney General. So my Senate Bill 106, that the decision about the individual mandate, this unprecedented intrusion of federal government into lives of Montanans, is too important for Montana to sit on the sidelines. We have to be part of that dialogue. And the way we want to be part of that dialogue is through joining the lawsuit, and we expect our lawyer to represent us well in that case. That's all Senate Bill 106 does. Senate Bill 241 is a bill that I have that will require, you may have heard discussions in the past about mandated health care benefits. It's one of the great all-time off-balance sheet transactions that politicians love to do. Let's provide a benefit for the public and let someone else pay for it. And we'll do that through insurance companies because that's really complicated, and people who are insured very rarely understand the cost of those services. Many times you think your employer, the insurance company, works for you when in fact they work for your employer. So it's a great chance to confuse the public about a benefit that we can give them through the legislative process, but we don't have to appropriate the funds. So this is one of the reasons we have 41 in the state of Montana, and they cost the average premium holder about $1,200 per person per year. So if you want to know why health insurance is expensive, this is one of the reasons, and government has helped create this problem. So what Senate Bill 241 does is it says, look, if you want to pass a mandate, what you first got to do is test it out on the public employees. That does two things. It creates a fiscal note, and it creates data that we can analyze the true cost of the mandate. So instead of having dueling experts, one person who says to treat one condition will be free. Usually what you hear is this saves money, but you can never find the place in the budget they cut. You can only find the line item where the expense is added. But you hear, well, this is going to save money. Well, we're going to get a chance to find out if Senate Bill 241 becomes law, because what it says is you first apply it to the employee health care plan. it sunsets unless the legislature says this is a cost-effective tool, and it requires the auditor to produce a report that says this was the cost and this was the benefit before that gets applied to private health insurance. So instead of the legislature now saying we're going to offer this great benefit, but we're really not going to tell you what it costs, we're going to get somebody else to pay for it, and people being frustrated by healthcare costs, we hope with 241 that we'll be able to stop that process and allow legislators to make better informed decisions about whether these mandated benefits do produce the cost benefit that they're proposed to produce. So those are the two bills that I have. So one is, as I mentioned at the beginning, one thing we're doing is we are trying to stop the implementation of Obamacare. But we recognize healthcare as a problem. Nobody is going to sit up here and tell you that we're happy with the price of health insurance, that we are happy with the affordability, that we think that everybody is able to get the insurance product that they need. We're not going to try to convince you of that, because we're employers, we're parents, we're grandparents. We know people struggle with this issue. So we can recognize the problem, but we aren't going to allow every single bad idea that's been tried in Massachusetts and Oregon to get lumped into one federal, one-size-fits-all, cookie-cutter approach to make sure that there are no differences in how states run their programs, so that all the bad ideas get lumped in. Federalism is a great thing because you get to see what's working and what's not. And so if the state of Oregon wants to have a single-payer system, and they want to go whole hog on Obamacare or Romney Care, or in Massachusetts, hey, that's great. But we have a better plan. We think we have better ideas, and that I hope you're going to hear some, not just mine, but you're going to hear from all these guys. And we're working really hard to address the fact that we agree healthcare is broken, but we're not going to break it further. And whenever we get the chance to distinguish between good ideas and bad ideas, we're going to make that distinction. We're not going to join in this process of implementing Obamacare and confuse in the minds of the public who created this problem and who broke it. Those lines need to be very clear, because when it breaks, most of us want to be able to say, we didn't break it. We fought it. We worked hard for common sense reforms that fit for Montana, and we're not going to go along with breaking healthcare for you. So that's why we're doing it, and I'm not going to use all my 10 minutes, and thank you very much.